Hello everyone, let's do our lab. This experiment we will observe the organphosphate toxicity and we will study how to save the life. Okay, we have studied organphosphate compounds and include dipteryx, rogo, malathion, DDVP. They are commonly used agents. And organphosphate, because of their toxicity, are widely used as insecticide, pesticide. But according to a survey in 2003, there is still a high level of health risk associated with the use of organphosphate among the rural workers in the developing countries. So the first pathway, organphosphate, for this reason, occupational contacts are via from skin. These occupational contacts are via skin pathways and due to scarcity of safety measures. No non-occupational contact is organphosphate is normally associated with self-suicide, commitment, and food contamination, in which organphosphate intoxication is via oral pathway. Severe organphosphate intoxication has a high mortality rate, in areas above 60% death rate. These pesticides can form a stable complex with cholinterase and thus inhibit acetylcholinase function of hydrolyzing released physiologically. Therefore, organphosphate intoxication demonstrates both M and N symptoms, developing on which organ is under consideration. And because organphosphate, they form an extremely stable phosphate complex with acetylcholinase and cause hard to reverse of acetylcholinase, which is the reason that organophosphates are normally called as irreversible acetylcholinase inhibitor. The mechanism of organophosphate toxicity we have studied in pharmacology. We know organophosphate can inhibit irreversible inhibit acetylcholinesterase, and then this bond is the irreversible and bound to this complex compounds extremely stable and inhibit this enzyme, so induce endogenous acetylcholine overactivity. We know acetylcholine will bind to its two receptors, M and N receptors. So, phospholipase overdose. The signs and symptoms includes M and N signs. So, in pharmacology, and later we will in our lab, we will observe the M signs and N signs of organophosphate toxicity. The M signs and symptoms include the central nervous system stimulation, meiosis, spasm of accommodation, bronchial smooth muscle contraction, increased smooth muscle secretory activity. Central nervous system stimulation is commonly which lead to convulsion followed by cardiovascular and respiratory depression. Increased gastrointestinal and genitourinary smooth muscle activity lead to stomach diarrhea and nausea and irritation. Respectively, enhanced secretory activity result in lacrimeation, salivation, and sweating. So that's now we reviewed the pharmacological effects of organophosphates, especially the M size. At first, bound to the M receptor and excitatory effects on eye, so meiosis. In meiosis, the pupil size smaller. So later, we will observe the first symptom is we should observe the pupil size. And the second one can excite M receptor on gland, promote gland secretion, so excitatory effects on gland, and induce cellular sweating and also induce respiratory and gastrointestinal secretion increase. And the third one also can excite smooth muscles and receptor. So excitatory effects means the smooth muscle contraction, such as the respiratory tract smooth muscle contraction, induce bronchial smooth muscle spasm, convulsion, and then induce dyspnea. So later we will observe the effects of organophosphates can reduce breath rates. And the excitatory effects on gastrointestinal tract smooth muscle, so means the stomach induce nausea and vomiting, gastric irritation. And on urinary system, so also have excitatory effects, promote smooth muscle contraction, and bladder sphincter muscle contraction, induce urinary incontinence. So later we will observe these effects on our lab. And for this reason, these are excitatory effects, but on the other hand, only on cardiovascular system. Inhibitory effects means negative inotropic action, negative chronotropic action, and means reduce heart rate and also reduce blood pressure. Organphosphate overactivity, so bound to N receptor and induce nicotinic toxicity. And we have studied nicotinic toxicity. That means central nervous system stimulation is also attributed to nicotinic effects. Other signs and symptoms include ganglionic stimulation and neuromuscular and plate depolarization leading to fasciculation and paralysis. Some patients even display muscle necrosis. We should know N receptor includes two major subtypes. One is N1 receptor. N1 receptor mainly lies on ganglion, show excitatory effects on ganglionic stimulation, and then that effects means the superiority effect, lots of symptoms. And then the second subtype is N2 receptor. N2 receptor mainly lies on neuromuscular junction, so skeletal muscle and plate depolarization, and then induce skeletal muscle fasciculation and paralysis. And that means muscular tension to be reduced. So later we will observe the last symptoms of organ phosphate is this one, neuromuscular junction. That means paralysis, fasciculation. Okay. And how to save the life? Our principle. So the first principle, we should diagnose the patients immediately. Because just now we mentioned the high death rate, about 60%. So doctors, you must diagnose the patients in time, and then you can give the drugs to save the life. How to diagnose organ phosphate toxicity? The first one, the patients, they have history. Oh, some of them, they are farmer, or some of them, their families will tell you, oh, quarreled with the families, quarrel with neighbors, and then drink organ phosphate. So have this history. And then, in account M and N signs, we can diagnose the patients. They are organ phosphate toxicity. We can take blood to test the level of isotretinoin esterase. Okay, so just now we have known how to diagnose the patients in time because the high morbidity. Okay. And in the world, in such as in China, and lots of self-suicide patients, they use organ phosphate. So we should know how to prevention organ phosphate toxicity. Organ phosphate toxicity, how to prevent. So we should follow with these principles. The first one, strictly execute the productive and regulatory regime of pesticides. The second one is reinforce protection of working and re-education of safety knowledge, and strictly control the sales of highly toxic pesticides to avoid self-suicidal case or food contamination. So we have known how to prevent the organ phosphate toxicity, and then this class and in clinic we have lots of patients, especially self-suicide patients, and we should save the life. So how to treat, how to save the life treatment. Okay, how to save the life? The treatment principle includes the first one. We should clear the organ phosphate and then use some special antidotes. At last, in accord with the symptom, we give some drugs as the symptomatic treatment, such as inhalation oxygen, or use some antibiotics, or use some drugs to protect renal and hepatic function, and so on. They are symptomatic treatment. The first principle, the first step, clearance of organ phosphates. Make sure the patient is removed from the pesticides prior to decontamination. So use remove the patients from the lockers in queue, and then decontamination to prevent further absorption. When the intoxication is severe, the patients can die all of respiratory and cardiovascular depression within several minutes. So remove of all clothing and washing of the skin with soap, basic solution, and promote vomiting. And promote vomiting in their home, and then the patients go to hospital. So in hospital, we should wash stomach. So gastric levels with 2% sodium bicarbonate or 1% normal sodium, except for diphtherics. That means if you know the patients drink diphtherics, you couldn't use bicarbonate to gastric levels, and you should use normal saline. Okay, so if you unsure the patients use which kind of organ phosphate peptides, and you should use normal saline solution to wash the stomach and to clear of organ phosphate. And then we also give magnesium sulfate because we studied the magnesium sulfate. Oral administration means promote stool, so induce diarrhea, purgation with magnesium sulfate. The first step, clearance of organ phosphates, and then we use some special antidotes. The antidote treatment consists of atropine and acetylcholine esterase reactivator, such as PAM chloride. Normal and effective way is to use atropine and isotoxin reactivators simultaneously for removing M signs and N symptoms at the same time. And atropine is the first choice. Atropine is the first choice for the treatment of this intoxication. Atropine can block M receptors and thus eliminates M symptoms. It should be administered as soon as possible via intravenous injection or intramuscular injection pathways. Last doses are recommended based on the severity of the intoxication. So, inhibit M symptoms and signs, we use M receptor blocker. The classical M receptor blocker, atropine, is the first choice agent to save the life to treat organophosphates toxicity. Atropine in last doses given as often as required to control M signs. Okay. The second drug is PAM chloride or orbidoxime. These drugs, they are cholinesterase reactivators. So this class, we will use these two agents to save the life. And the third principle to save the life is the symptomatic treatment. Just now I have explained we can give our patients inhalation oxygen or use some antibiotics or use some drugs to protect hepatic and renal function and so on. Okay. And we use cholinesterase reactivator such as PAM chloride because this PAM chloride can bond to organophosphates as the compounds. So make isotoxin reactive. But just now we also mentioned organophosphate isotoxin means the irreversible. Irreversible means hard to alive. Means we couldn't relax from this organophosphate. So we give the drugs to save the life. The first choice is atropine. And in fact, PAM chloride have some therapeutic effects, but not as the first choice. Okay, so let's do our lab. This lab, we have three aims. The first aim, we want to observe the symptoms of organophosphate poisoning. So we want to observe the M and the N signs. And second aim, we want to understand the intoxication of atropine and cholinesterase reactivators. Just now we explained the effects of atropine and PAM chloride. And the third aim, we want to learn icing method of isotoxin in whole blood. Okay, so we have three aims. Let's do the lab. In this experiment, we will use rabbit as our laboratory animal. And we will use these drugs. The first one is heparin. Yes, we have studied heparin. It is one kind of anticoagulator. Yes, we use heparin to inhibit coagulation. The second drug is dipteryx. Here is the dipteryx. And 2.5% dipteryx. We use it as the commonly widely used organophosphate, and later we use dipteryx and observe the organophosphate toxicity. The third one is 2.5% pyrroloxime methylamide solution. It is the PAM chloride. And it is the isotoxin reactivator. That's number 4. The fourth agent is the atropine. It is the M receptors blocker. And the number 5, the fifth drug is the 0.25% chloride isotretinoin esterase. Isotretinoin, so we use isotretinoin. And later we will test isotretinoin esterase enzymes level. And the sixth one, BTB. So in your desk, the yellow solution. And in accordance the color, we can know the level of this enzyme. Okay, the last one is distilled water. And the experimental equipment includes 6 injectors, 3 test tubes, and 3 granulated pipes, 3 capillary pipes, and knife, cotton, and thermostatic water baths. Okay, so let's do the lab. The first lab, okay, each group take one rabbit. Do you take a rabbit? And you should weight their body about 2 kilo. Okay, so 2 kilogram, the body weight of your rabbit. And then put your rabbit on the desk. Let's observe the normal M and N signs. The first sign, you should observe the activities of your rabbit. Oh, it's very lovely. And your rabbit, the activity of your rabbit is normal. And then you should calculate the breath rate. And how to calculate the breath rate? Test the abdominal cavity, and you can feel the breath rate. And the third one, observe the pupil size. And number 4, use some tissue to observe the salivary secretion. And then the fifth symptom is urination and defecation. No, yes, your rabbit very clean. And the last symptom, and you use your hand to test the muscular tension, and it's normal, and no paralysis, no fasciculation. Okay, so let's do the lab. 开始，
瞳孔的大小，这样行吗？
Okay, let's do the lab. And at first, use on your table, you can find this. And we use this one to observe the pupil size of the pupil size. In normal, the pupil size about 7 to 8. Okay, we use the ruler to observe the pupil size about 7 to 8 millimeter. It's normal. Okay, and then we will calculate the breathing rate. And how to calculate the breathing rate? Like this position. We touch the abdominal cavity, and then we want to observe the rabbit is cellular or no. Okay, it's normal. The means that the gland secretion isn't increased. And then the last symptoms, we should test the muscular tension. Oh, it's normal. And our rabbit about 2 kilogram. Okay. Okay, let's continue our lab. Just now we take the rabbit and observe the normal M and N signs. Okay, and we also record this breathing rate. So each minute, 30 time each minute. Pupil size 7 millimeter. No cellular secretion, no urination, no defection, and the muscular tension is normal. Okay, and then we will prepare test tubes. Each group take 3 tubes, and use your pen, mark them respectively with 1, 2, and 3. And in each tube, you should add 1 milliliter distilled water in 1, 2, and 3 respectively. Okay. And then in normal, you should clean the ear vein. Clean the vein on the edge of rabbit's ear with alcohol cotton ball in order that the vein is more congestive. Interact it with a operating knife and get 0.02 milliliter of blood with a capillary peptide into the tube. 1. To assay isocycline activity in normal. Don't forget, after you take the blood and press the intersect of the vein with a dry cotton ball if the wound is bleeding. So let's do the lab. Thus now we have observed the normal the pupil size and no cellulation and no diarrhea and the muscular tension is normal. Okay. Okay, let's remove the hair of the rabbit ear. Use the razor. Okay. Also, you can use the alcohol ball to make the vein expansion. And we use operative knife to cut the vein. This is the capillary peptide. In fact, in them fill in heparin. So later, when we take the 0.02 milliliter blood, and heparin can inhibit coagulation. Use the operative knife to cut the vein. Okay. We only need 0.02 milliliter, so that's enough. How to use this microbial capillary peptide? Okay, this here is the 0.02 milliliter, means the 20 ml. If the blood over more than 0.02, we can use the paper to remove the more blood. And then put this 20 ml blood into the first tubes. And in the first tube, just now we have added 1 milliliter distilled water. And later we will use this peptide to observe the acetylcholine level of acetylcholine. Okay, so now we take the take the blood in the first tube, and we also observe the normal activities. So let's have a break, and then we will give Dipteryx, and you should prepare for saving life. Okay, take a break.